has a body and the lesser vein, the greater vein, and it's almost articulated with all the bones of the skull except from the lacrimal bone, the nasal bone, and the mandible. Here in front is the orbital process of the frontal bone. Here is the clavicle plate.
So the clavicle plate basically is one.
And so it has a body which is has a depression in the center. Maybe you can appreciate here on this skull, which has a depression for the pituitary gland. It's called the talus persica. It's depression. The lesser vein arises with two alars, which is not very clear here, and between the two alars is formed this a canal, which is called the optic canal, and through which passes the optic nerve and the ophthalmic artery along with the sympathetic plexus. Just behind the lesser vein, between the greater vein and the lesser vein, is another opening, which is the superior orbital fissure. And the superior orbital fissure basically is the one which transmits the rest of the cranial nerves to the orbit, the third, fourth, and sixth, along with the ophthalmic vein, superior inferior, with the sympathetic plexus and posterior along that.
Also, the ophthalmic nerve, which is the branch of the trigeminal, also passes with that.
Maybe you can actually. The optic canal and giving in the lesser vein is another opening, which is the superior orbital fissure. And the superior orbital fissure, vein, superior inferior, basically is the one which transmits the rest of the cranial nerves to the orbit, the third, fourth, and sixth, along with the ophthalmic vein, superior inferior, with the sympathetic plexus and posterior along that. The body has a groove in its lateral aspect. You see here, that's the carotid groove. I have just put a wire as a carotid artery lying in that groove, right? So, further going towards the greater vein, there is.
So this carotid artery basically rises from the carotid canal and transverses above the foramen placerum and then lies in the groove.
This foramen is behind the superior orbital fissure. This is the foramen rotundum. This transmits the maxillary nerve, the branch of the trigeminal nerve. Way backwards is the foramen popliteal, which has the mandibular nerve transmission, the accessory middle mandibular artery, the lesser petrosal nerve, and the hemispherians. Behind that is the foramen spinosum. It derives its name because it is a spine just on the inferior aspect of the sphenoid, and it transmits the medial artery, right? There is another foramen called the foramen lacerum. Actually, the foramen lacerum is here. I will put there. So this foramen lacerum, you see better on this one. So this is the foramen lacerum, and it is basically not a foramen. Is largely being connected by the sphenoid bone. There is an inferior orbital fissure. I will show on the clear skull. It's better visible. Yes. You see here that is a superior orbital fissure. Then that's the inferior orbital fissure down there. The inferior orbital fissure basically transmits laterally transmits communication to the temporal fossa. The middle part transmits the communications to the infratemporal fossa, and then the middle part goes towards the pterygoparietal fossa. So it's a very good communication between all these fossas. If you see laterally, this is again the sphenoid related to the sphenoid, which articulates with the part of the parietal bone here. Inferiorly, if you look at it closely, at the junction of the body and the greater vein, these are the two pterygoid plates. The pterygoid plates are better visible on this bone. here. Yes. So the medial pterygoid plate has elevation called the pterygoid hamulus, where is attached the right palatal muscle along the pterygomandibular aspect. Right? So you can see all these structures.
So when we see the anatomy or osteology of the isolated sphenoid bone,
Sphenoid, and this is anterior view, and you can see the anterior wall of the sphenoid destroyed. You can see the sphenoid sinus very clearly on both the sides. Estivostum of sphenoid, the greater vein and the lesser vein. At the junction of the lesser and the greater, you can see very well the superior fissure, and it's coming down. You see this foramen, that is the foramen ovale.
sorry, Sutandam.
And below that foramen is the foramen body and pterygoid nerve, the pterygoid canal.
Median canal.
And these are the pterygoid plates. You flip it across and you see the posterior aspect as the solatessica, the superior orbital fissure, the foramen ovale down there. Sorry, foramen rotundum, ovale and spine. Right? And the carotid artery will be here in this thing. So this is that.
So next bone which I would like to explain is the maxillary bone, which articulates closely with the sphenoid, and we see it on 3D osteology. So you see that's the posterior aspect of the maxillary bone. There are two bones right at the midline, and you will appreciate it has a large, very large ostia. But when you are doing a functional endoscopic sinus surgery, you will find a very small ostia. This is because that the anteriormost part of the ostia anterior superiorly is covered by the lacrimal bone, and inferiorly by the uncinate, inferiorly by the inferior turbinate, and posteriorly by the perpendicular plate of the palatine bone. That's why it's like looking very small, at the 4 millimeters or 5 millimeters in size. So that's a huge ostia which is naturally present, it is covered by the other bones.
Now we look at the maxillary bone. So the maxillary bone has this body, central body, and processes which provide attached to it. This is the orbital process. This is the orbital rim, and this is the orbital process forms the floor of the orbit. This is the thinnest of the processes of the maxillary bone, and a fracture, a blow fracture to the orbit can actually easily cause fracture of this part, and the orbital fat can collapse into the maxillary sinus. It is the frontal process of the frontal is the process of the maxilla.
Actually articulates with the nasal bones anteriorly, and posteriorly the defect is for the lacrimal bone.
Here you see is the palatine process. This process which is going backwards, ventures. This is the palatine process.
And basically it forms the anterior 2/3 of the palate, heart palate. The rest of it is formed by the horizontal plate of the palatine bone. You understand that?
This is the alveolar process. And here is the zygomatic process. So there are 5 processes which form the maxilla and the body along with the maxilla. So if you see how it plays inside the orbit, see the skull. Here is the orbital plate, orbital process. It articulates with the zygomatic process, the zygomatic bone here. It articulates with the lacrimal bone usually, and the lamina trapezius.
It's very important to visualize this in mind. There's a lacrimal bone, and behind that would be the lamina trapezius, and below is the orbital plate of the maxillary bone.
Backwards, lamina trapezius is point one. So, certain foramens are also worth mentioning. You see, this is the infraorbital foramen, lying 1 centimeter below the infraorbital margin, and transmits problem. You see on the parallel side, you have this space which has the incisive foramen, which is in the pre-maxillary part of the maxilla, the part behind the incisor tooth. That's called the pre-maxilla sometimes, and as the incisors form for the ethmoid nerves. And this is the junction of the hard palate with the palatal bone. Here you find another foramen, which is the foramen for the greater.
So you can appreciate that the junction of the palating process of the maxilla joining with the horizontal plate of the palatine bone. You have this foramen transmitting the important artery there.
Greater.
Palatine arteries. Right? So that's about the maxilla.
So obviously you must be maxilla very much understood this bone. It has a pterygium plate. There are two labyrinths on each side and there is a perpendicular plate of the bone. How it articulates with the other structures in the nose and forms the anterior fossa should be clear in your mind. Is the my attempt for explaining this. So just look at this. So this is the lateral aspect of the ethmoid bone, and it shows and the structure in front of you is the lamina trapecia. That is, which is coming down are the concave and gastric staphyla up there. The posterior view is showing the labyrinth with the cells, the perpendicular to ethmoid coming into view now. Just see this, sorry. See how the palatine bone perpendicular process is articulating the labyrinth and compromising the osteus, the maxillary ostia. This is a very good visualization of this perpendicular plate going there, and the labyrinth occluding the maxillary sinus. So that is these are the parts of the anterior view of the ethmoid bone, which is showing all the structures. That's the superior view showing the piriform plate and the testicle. That's the lateral view. The palatine bone is a very central bone, actually lies way in the middle of the skull, and it's very difficult to understand the bone, how it's placed. So we will have to look at this with an endoscopic image after this to understand. It looks like this. There is a horizontal plate and there is a perpendicular limb, which has two processes, a sphenoidal process and an orbital process. So it's placed like this behind the palatine process of the maxilla. That's the posterior part, or posterior view, sorry. That's the inferior view, how it looks like. Vomer is another very interesting bone which is not actually properly understood. You see, the vomer is like this here, and if I remove the vomer, it looks like this. Vomer has been removed, and you can see this part is the space where the vomer was occupied. It's a trapezoid bone, and its posterior view is like this. It's a vertical bone behind with the ala up. Lateral view is very interesting and shows you how it articulates with the osmosphenoid here, the perpendicular plate of ethmoid here, the vertical arteries here, and the free edge behind, right? So it's like this, how it's placed in the skull. This is a small attempt to show you an anatomy of the skull, on a dry skull. I myself fascinated that the structure are quite well preserved in a dry skull, which is even very old. So it's a small attempt to show you few structures inside. So that you see is the nasal bones, the frontal fossa of the maxilla. When you go inside, You see, this is the inferior tongue right there. You see, this is the uncinate bone there. The frontal process of the maxilla is missing here. That's why you'll be able to appreciate this thing. This thing is a lacrimal bone. So it's so intricately attached. It's a very thin bone, and that's why we are doing a surgery very well on the lacrimal sac here, right? So that is the floor which I was talking about, the palatine process of the maxilla, and that is here is the palatine bone, the horizontal limb. You have to understand this. That's the vertical limb there. Vertical limb there. Right back is the sphenopalatine foramen here. This is the sphenoid bone, proximal sphenoid, and that would be the sphenopalatine foramen there. I will go inside and show you how it can be seen by in the dry bone also. So, this was just an attempt to look at the nasolateral drainage system here. And you could see that area was the area where the energy would have been there and the drainage would have occurred. Going inside, there's the actually ostia, the arsenate. So just that is the bulla which has been opened. Going back, that's the perpendicular bit I was pointing at of the palatine bone. Once I go back behind the crista, that's the crista. Behind that, you will find the sphenopalatine foramen. So that's the foramen there. That's the sphenoid ostia, which has been just been broken on the bone. The other side, perpendicular to the ethmoid there. You can see this structure in the sphenoidal process of the palatine bone. I'm talking about two processes. This was the one. That's the clivus there. And you can also very well see the cribriform plate there. Both the sides, there are 16-17 holes there, drawing for the olfactory nerves arising from the olfactory. The holes are going up to the olfactory bulb. So I think it's very clear. All these things work up. That's whole entire thing is the labyrinth. That's the labyrinth working inside the nose, right? So I think it's a small talk on the osteology. I was just trying to explain the fundamentals about it, how to go about it.